Okay, so let's get into it. In our, well, really fast-paced world, we're always needing reliable information and quickly, right? Especially for those big decisions in healthcare and policy.
Absolutely. And we know getting those thorough, evidence-based answers often takes a lot of time. Full systematic reviews, they're the gold standard, but the resources required.
Exactly. They demand so much time, so many resources. It's a real challenge.
hmm And that's really where rapid evidence assessments, or REAs, you might also hear them called rapid reviews, it's where they emerge. They promise quick insights.
Quick insights, yeah. But historically, I gather they haven't always been, let's say, the most transparent.
That's been the issue. A lack of clarity about the methods, leaving people wondering, how rigorous was this quick review?
And that transparency gap, that's precisely what we're diving into today. We're looking at this fascinating paper by Varker and colleagues.
Right, Varker et al. They're really trying to bring some clarity, some structure to this whole methodology.
So the big question is, how do we get reliable evidence fast, but in a way that we can actually feel confident about? Okay, so we see the need, but let's pin down exactly what an REA is. Our sources talk about it as a way to quickly summarize what's known.
Yeah, think of it as a focused literature review for a specific clinical or policy area. It's designed to deliver essential information to policymakers, healthcare professionals, even to you, the consumer, when time is really tight.
A pragmatic middle ground, you called it.
Exactly. Full systematic reviews are incredibly time and resource intensive. REAs aim to keep a lot of that rigor, locating, appraising, synthesizing evidence, but in a much shorter time frame.
So it's about making smart concessions, not just cutting corners randomly.
Precisely. Smart, explicit concessions. But as you mentioned earlier, historically, how those concessions were made varied a lot.
Right, which led to that lack of transparency, limited critical appraisal, leaving end users maybe a bit unsure about the validity.
And that's the core problem Varker and their team are tackling.
Okay, so Varker et al. They step in with a solution. What does that look like?
Well, they propose a really clear, three-phased approach. The idea is to make the whole process explicit, transparent, and crucially reproducible, like a clear roadmap.
A roadmap for speed and clarity. I like that. So what are some key principles they highlight to maintain that rigor even when moving fast?
It really starts right at the beginning with a very clear, concise question. Often, they suggest using the PICO framework.
PICO, remind us.
Sure, participants, interventions, comparators, and outcomes. It helps make the question super precise, and importantly, it's developed closely with whoever needs the answer, the end user.
Makes sense. Get the question right first. What about finding the evidence?
Here's a key efficiency step. Their search strategy prioritizes finding existing high-quality systematic reviews and meta-analyses first.
So they look for the big summary studies before diving into individual ones.
Exactly. Those are highly robust sources. It's a smart way to leverage existing work and speed things up without just, skimming the surface. Only then do they delve into individual studies if needed.
Okay, that's clever. But you mentioned appraisal. What really seems to set their method apart is this focus on assessing the quality of the total body of evidence. Not just study by study, but the whole picture.
Yes, precisely. This is where their methodology truly shines, I think. They don't just summarize what was found. They go further and assess the evidence across 5 key domains.
5 domains. Okay, what are they looking at?
So first, the strength of the evidence. This considers the quality of the studies, like are they robust level I trials or maybe lower level 4V studies, but also the quantity. How much evidence is there?
Okay, strength. What else?
Then, the direction of the findings. Is the evidence generally positive, negative, or maybe unclear? Third is consistency. Do different studies point in the same direction, or are the findings all over the place?
Right, consistency matters.
Absolutely. Fourth is generalizability. Can we apply these findings to the broader population we care about? And finally, critically, applicability.
Applicability, how's that different from generalizability?
It's more specific. It's about whether the findings actually make sense and can be applied in the local context within the specific health system or setting. Sometimes findings from one country just don't translate easily.
Got it. So strength, direction, consistency, generalizability, and applicability. That's a pretty comprehensive look.
It provides a much, much richer understanding than just a simple summary. It really highlights the nuances and potential limitations.
And I read they even have an optional ranking system. Supported. Promising.
That's right. To make it even clearer for the end user, they can classify the overall evidence for an intervention as supported, promising, unknown, or even not supported. That gives a very clear bottom line.
Okay, so pulling this all together, why does this more transparent, rigorous approach to REAs matter so much to, say, someone listening right now?
Well, it means that when you encounter an evidence-based recommendation that came from an RDA using this kind of methodology, you can have much greater confidence in its foundation.
It's about trust, isn't it?
It is. It makes those trade-offs between speed and depth explicit and visible rather than hidden. You understand the strengths and the potential weaknesses.
So it empowers you, the listener, not just to passively accept the information, but to actually understand how it was gathered, how it was assessed.
Exactly. Knowing these principles helps you ask better questions, engage more critically with evidence-based decisions about health policies, new treatments, things that directly impact your life.
So what's the big takeaway here? It seems these transparent, rapid evidence assessments are more than just useful. They feel pretty essential now.
I'd agree. They're vital tools in this world where we're flooded with information but always short on time. They act as a crucial bridge.
A bridge, allowing us to get to complex evidence quickly, but without totally sacrificing that critical appraisal we need.
Precisely. Access and understanding with a clear view of the evidence's reliability.
So maybe next time you hear about a new guideline or a quick policy recommendation based on evidence, it's worth pausing to wonder, was that just a rapid splash? Or was it a truly transparent deep dive, the kind Varker and colleagues are championing?
A great question to keep in mind.
Thanks for diving in with us today.